Hello everyone, I am Dr. Kirtana Kiran. I am currently pursuing MD Nuclear Medicine at AIIMS Bhubaneswar. Today, I'll be talking about a fascinating and often misunderstood branch in medicine, that is nuclear medicine. Nuclear medicine is a very new branch. In Western countries, this branch is considered as a super specialty often pursued after radiology, but in India it is recognized as an independent specialty branch. This branch combines principles of physics and chemistry with medicine. What makes nuclear medicine different from radiology is that in radiology we see the anatomy of organs, but in nuclear medicine we see how an organ functions, that is, physiology. We use very small amounts of radioactivity called radiotracers. The principle is that an unstable atom or nucleus undergoes radioactive decay to achieve a stable state, and this radioactive decay can be alpha rays, beta rays, or gamma rays. In nuclear medicine, we use alpha and beta emitting radionuclides for therapy and gamma emitting radionuclide for diagnosis. We use them alone or we tag them with a molecule that localizes these to the organ of interest. Like for example, in bone scan, we use technetium 99M MDP. Technetium 99M is the radionuclide and MDP is the physiological molecule that localizes this to the bone. And once the radiopharmaceutical is localized to the organ of interest, we image radiation with special cameras called gamma camera or PET scanner to create a detailed image. 75% of nuclear medicine is diagnostic imaging and the rest 25% is therapy. This balance is what makes the branch dynamic. We not only diagnose diseases, we even treat some of them. One of the most powerful diagnostic tool is PET-CT scan. PET-CT combines the functional power of PET with anatomic clarity of CT. PET-CT is crucial in cancer detection, staging, and response assessment to therapy. Apart from oncology, PET-CT is also used in infections and also various other inflammatory conditions. There are a lot of PET radio tracers and the most commonly used one is FDG PET-CT. Apart from FDG, we have gallium-68 PSMA PET-CT for prostate cancer. We have Dotate PET-CT for neuroendocrine tumors and other new tracers like Pentixafor, Trivexin, FAPI, etc. A lot more tracers are still under development. Apart from PET-CT, we have a wide variety of planar and SPECT imaging procedures which deserve their own explanation. I'll just brush through some of them which we do on day-to-day basis. So for cardiac, we have myocardial perfusion scintigraphy, we have MOGA for ejection fraction, and for skeletal system, we have bone scan. For renal, we have DMSA, DTPA, EC scan. For liver, we have HIDA scan. For thyroid, we have the most important whole body iodine scan, thyroid uptake scan, and for parathyroid, we have sestamibi scan. Apart from this, for GI, we have GI bleeding scintigraphy, Meckel scan, reflux studies, etc. For brain, we have brain SPECT for seizure focus identification. We have DAT scan for Parkinsonism, and we have VQ scan for lung, salivary scintigraphy, lymphoscintigraphy, and infection imaging, etc. So these are a few of the scans that we do on day-to-day basis. So all the scans are critical for diagnosis and treatment across various specialties. Now let's talk about therapy. One of the most exciting aspects of nuclear medicine therapy is precision with minimal side effects. Radioiodine therapy with iodine 131 has been the cornerstone treatment for decades for Graves' disease and differentiated thyroid carcinomas. Apart from radioactive iodine therapy, we have PSMA therapy for prostate cancer, we have Dotate therapy for neuroendocrine tumors, and also new therapeutic options like FAPI are being explored in various malignancies. We also perform radiosynovectomy in few inflammatory joint diseases like arthritis. A very exciting and recent development in nuclear medicine is interventions. This is very close to my heart because I have done my thesis in this area. PET-CT guided biopsies are now routinely performed for lung mass, for bone lesion, for retroperitoneal mass, and studies have shown very good diagnostic yield. Apart from this, we have a targeted therapy called as transarterial radioembolization, where radiolabeled microspheres are injected directly into the feeding vessel of the tumor in the liver. The field of nuclear medicine is still developing and rapidly evolving. With the development of new radiopharmaceuticals and new theranostic agents, the future holds immense potential. Even within my short period of time in this branch, I have witnessed significant changes and innovations. So, this is truly a smart science. That is nuclear medicine in a nutshell. And thank you very much for your time and interest.